whoa, there's so much bad information, but would you agree that it's diet, or what would you think is like the main cause?
I think diet is a biggie. Give you an example. You would have to eat 12 bowls of spinach today to equal the iron concentration of one bowl of spinach from the 1930s.
Whoa.
Okay?
Who's watering down the spinach?
And we are back with another episode of Sarasota Speaks, episode 71. As always, my name is Brad Hannon.
Trey Martell.
Felipe Colon.
Felipe Colon, is that it? Felipe Colon today?
That's it. That's all
right.
they get.
Well, listen, it's about the guest anyways, and today we've got an amazing guest. We've got Dr. DeSilva, an expert in anti-aging and anti-aging medicine, correct?
Correct.
I don't know that anybody out there cares about getting old or ugly when they get old or unhealthy, but we'll try to make them care. Yeah. Just kidding.
No, nobody cares, especially here in Sarasota.
Yeah,
right?
Obviously, it's probably one of the most important things, right? So we're excited to have you on, excited to kind of dive into this. But before we dive into how you do it, let's talk about how you learned and where your background is, because you're kind of a world-renowned anti-aging doctor. I would love to highlight that.
I've been doing this for a very long time, Brad. This is my 37th year in clinical practice. I'm traditionally trained as a physician, as an MD in internal medicine. And about 35 or so years ago, I realized that there were a lot of people who were getting treated, if you will, the traditional way, right, with the prescriptions and all of those things. But they were missing a big piece of their diet, their nutrients, their hormones, their spirituality. There were gaps in treatment.
Yeah.
And I see that even today. I think the gaps are being filled, but I think that there's still a lot that needs to be done. And, that's kind of how the whole thing evolved for me.
Yeah. And when you say traditional with medicine, what I hear is, traditionally what we see in practice is we're treating symptoms, right? And so when I hear that, I kind of hear you're treating the whole person, right? You said the spirituality even. I'm curious, how do you, what factor what role does that factor play in health from your professional standpoint?
That's something that I've incorporated. I was trained, I went to college at St. Francis University. So I was trained by the Franciscans. I've been raised, I'm Roman Catholic. I was born in Sri Lanka, but I'm Roman Catholic.
Right.
We can talk about that some other time. But I think, you would be amazed how many people, when they go to surgery, will say, I always say, good luck and God bless. And you can't imagine how many people say to me, would you mind saying a prayer with me? And I get goosebumps as I say that. One of the reasons for that is there was a conference called Spirituality and Healing. It was held by a gentleman at Harvard University, wow. Dr. Herbert Benson. So Dr. Herbert Benson did a 3-day conference called Spirituality and Healing. So he would bring priests, rabbis, all clergy, plus medical researchers, Larry Dossey, God rest his soul, and many other people that did research in spirituality. And just a quick example, yeah. He did a study that showed that there was a group that was at UCLA. They prayed for a group of patients at UCLA University, and the people that were saying the prayers were in Australia. They prayed for the people that were in bed 1, 2, 3, and 4. They didn't pray for the people in bed 4, 5, 6, 7, and 8. Or 5, 6, 7, and 8.
Right.
What they found was that the people that they prayed for had better outcomes across the board. Infections, pain, healing, longevity, stay, etc.
Wow.
So I always tell everybody, hey, just pray for me. I don't care what religion you are. Right. Just say a prayer. Who cares?
Right.
But big piece of healing.
That's huge, and it's backed by science, right? That's
it
not
is.
like it wasn't a church that did this. It wasn't just a focus group in one area. It was kind of multiple people from multiple different areas coming together. So the results are kind of uncontested, I would imagine.
Absolutely. And the other thing is good deeds. If you do a good deed for somebody. Let's say that you hold a simple thing. Somebody walks into the room behind you, in front of you, you hold the door. The mere fact of you holding the door boosts your immune system, if I was holding it, by 40%.
Wow.
It boosts your immune system, the person I held the door for, by 40%. But here's the beauty of that. Every single person that witnessed that good deed, their immune system gets boosted by 40%.
Equally.
And I'm not making this up. These are studies, this is data that's out there.
So when you quantify that by 40%, what does that mean? And how long does that effect last?
That boosts your immune function by 40%. So there are certain markers in the blood that can be measured, and that's how they did it, called immune globulins. They measured them, and it was immediate. But remember, the immune system effect is something that can last for hours. You know, it's yes, immediately there's a boost, there's a spike, but it doesn't do this. It'll spike and then it'll taper down. So
Until you find another door.
Until you find another door.
We're gonna catch Trey all around town, just open the door.
That, or letting somebody out in traffic. Right, you're in traffic.
That does
Just
make me feel really good.
Yeah.
It makes you feel even better when I get the wave back.
Yeah, exactly.
It makes me
Exactly.
think about the germaphobes that are afraid to touch that
You
door.
look like
and open
someone
it.
that won't let people in traffic.
If the germaphobes, I did it today, actually, I was stuck in that traffic a long time, but the germaphobes, they just grab and open that door, they wouldn't have to worry about the germs because their immune system got a 40% boost.
Right,
so.
exactly.
So, but what's for the layperson, like what's some of the science, without getting too far in the weeds behind that? Is it something to do with your brain center senses that you're doing something good, it knows you're doing something good, and then releases something that then has the knock-on effect on your immune system?
So, prayer, right? Prayer is, we know for a fact that when you pray, spirituality does, and it doesn't, I'm not talking about going to church, whatever your deal is.
It's a belief in something greater,
right? What happens is that the body releases certain, as I said, use the word immune globulins. When those factors are released, those endorphins are released. What happens is there's an effect on the immune system. The quantification, what you're asking is, how does that happen? It happens through the brain, it happens through the gut, and it happens through the entire immune system.
Wow.
70% of your immune system resides in your gut. So having a healthy gut, you're talking about getting to the source of disease, it's in the gut.
Yeah.
It's happening in the system. That's what you need to do. It's so important.
And we've kind of talked about that before on the podcast with a clinical nutritionist as well, and I want to get to that, but I just have to point out how much I love the fact that we started with spirituality, because when you think about like wellness, anti-aging, and you think about all of the things that factor into that, I think we just pulled the most out of the box topic and hit that first, right? Like that is, you're not hearing that from many doctors, right? You're not hearing that from, the general public either. So love that we tackled that. What are some more of the traditional, case studies you would have, if you will, for how you're helping, to steal Dr. Rob's,
Get better,
quote,
not
how are you
older.
helping people get better and not older?
Right. So what you want to do is, let me give you another example. Fatigue. Somebody's tired, right? One of the biggest complaints that people have are, I'm tired. You go through the traditional steps. You go through the blood work. You go through the heart evaluation. You go through the stress test. You go through all of that. But there are little things that are left out. Example, a 50-year-old woman. I have, if I see one more menopausal woman, I'm going to scream. It's unbelievable. When I go somewhere, I was sitting, when on my way down here on the plane, there was a lady sitting next to me, definitely menopausal.
How could you tell?
What's that?
How could you tell?
Oh, I know. I know. There's a certain aura. There's a certain feel. As soon as they start talking, you can tell. Yeah, it's just unbelievable.
The door trick doesn't even work for her.
This is when the comment sections get lit up with menopausal women.
This is one of the topics where you should probably just let him talk and listen. That's the clinician here.
No, but seriously, When you look at somebody, when I look at a person, even a man, right? Even an andropausal male. And what does an andropausal male look like? An andropausal male is a man that is between 55 and over. He's upset, he's angry, he's got a belly, he's just not himself.
Right.
When you go back and look at the woman and what the problem is, fine. You've had your blood work done, you've had everything checked out, the doctor comes up to you and says, "You're fine. There's nothing wrong with you. You're totally fine." Well, am I?
Maybe you're just working too hard.
Maybe you're working too hard. Maybe you have a lot of family stress. You know, there's a lot going on. What about your hormones? What about your hormones? Oh no, hormones cause cancer. Well, do they really? Do they really cause cancer? Or are the studies misinterpreted? Is the data not interpreted improved? You know, the data interpretation is the problem.
Right.
Who interpreted the data and what is it really saying? So what I do is I take that to the next level. What are your hormones? What is your ferritin level? Why are you tired? You know, you've had a menstrual cycle for 40 years. And you've lost blood every month for 40 years. Even though your blood work is normal, your ferritin, which is your iron level, is going to be low. You're going to be tired.
Right.
Right? What about your thyroid? Oh, your thyroid blood work is normal. It's not normal. You're losing hair. You're cold. You're exercising and you're gaining weight. You should be losing weight. You're constipated. You're constantly tired. You can't sleep. You can't think. This is what the mid-50-year-old woman looks like. The 60-year-old guy is somebody who has a belly, who is starting to get what we call man boobs, is starting to get breasts, and they're aromatizing. But there's nothing wrong with you. I'm not looking at you for a reason. I'm just saying.
There's definitely nothing wrong with that.
No, but seriously, the doctor looks at your blood work and says, "There's nothing wrong with you." Well, there's a lot going on here. Your testosterone's low, your DHT level's high, your estradiol level is high. I need to treat you, and there's certain things that I can do to help you.
So in that specific instance, the man over 55 with the belly and he's tired, what are some of the things that you can do for him?
The first thing I'm going to do for him is have a conversation with him and say, your testosterone level is low. Now, here's the other problem, Trey. The other problem is that we have what are called reference ranges. Yeah. The reference range for testosterone, okay, is between 250 and 1,000.
Isn't it even higher than that?
Well, it can go up to 1,200, depending on the lab that you're using, right? But let's say 250 to 1,000. Well, 251 is normal. But is it really normal?
Right.
I don't want to be at 251. I want to be close to 1,000.
Exactly.
Brad wants to be 1,200.
2,000.
There was a gentleman by the
sign me up for 2,000
by the name of Dr. Alan Mintz. Dr. Alan Mintz was considered one of the fathers of age management medicine. And I will never forget when I heard him say this. He said, "Normal is a risk factor for disease. I want you." And I want my patients to be optimal. Exactly what you said, Trey. Yeah. I want you to be optimal. Yes, I want you to be between 900 and 1,000. But wait a minute. Testosterone causes prostate cancer. Oh, no, then I can't do testosterone. But wait a second here. Who gets prostate cancer, gentlemen? At what age do you get prostate cancer?
Very old people. And it goes very slowly, right?
Go easy. Okay, go easy. Yeah. I'm 67.
Oldish.
Older people. So you get prostate cancer in your 60s and 70s.
When your testosterone's low.
When your testosterone's low.
He picked up on that.
You got that,
yeah.
right?
Proud,
you may be on the roof, but you're good, man. You're good.
I'm right here.
You're right there on the roof. Do 18 and 20-year-olds get prostate cancer?
No, and they're loaded with testosterone. So
testosterone causes prostate cancer. In a mouse study that was done in the 1920s, yes, that's where that started. So the misinformation that is out there is what has ruined my generation of women and men and scared the daylights out of them.
I think that beyond your generation to my generation and Felipe's generation as well. So just because he's like right in between. Right?
He's right in between us, I'm sure.
But so I agree with that wholeheartedly, but I have seen a trend in the right direction, let's say, with hormones and hormone replacement therapy. I'm okay with saying that I'm on hormone replacement therapy. My testosterone level before I started would have been, I guess, in the normal range because I was like 300, like very low 300s. And when I was talking to the doctor about the hormone replacement therapy, it's like we've really got to find, the range is, like you said, 250 to 1,000 or 250 to 1,200. And so I want to get you to 1,200, let's say, or 800 to start, see how you feel. I think it was lower at first, 800, see how you feel, get the blood work done, bump you up to 1,000 if you still feel great. Like, we want to know what's optimal for you. I can say, for sure, the 1,200 or so, I don't experience as much of that fatigue and tiredness.
Right.
I'm sharper mentally, I feel like. Right. Obviously, I'm stronger, and it's better to stay in. It's easier to stay in shape, but of course, diet is a huge factor.
And
because
that's a big piece of
it. Garbage in, I'm still gonna.
You can't eat bonbons and yo-yos and
just
take
testosterone.
Okay, it's just not the way it works. But everybody has a sweet spot. My sweet spot is between 900 and 1,000.
Yeah.
I've been on hormones for 15 years. And it works. It absolutely works, and it makes me feel fantastic. I could climb a roof without a ladder. I don't know if you know that.
He can scale the wall.
I can scale the wall.
This is impressive.
So tell me about. The prostate cancer one. Obviously, we've heard that. But what are some of the other, I guess, counter arguments to hormone replacement therapy from the people that would be against it?
I got one. What about mood shifts? Like you get angry, roid rage, if you will.
That's exactly what it is. They were using steroids. Testosterone is not considered a prednisone steroid. It is a different type of
It's a synthetic hormone, right?
Well, it's a form of hormone that is more natural. That type of rage, there's two reasons. One is they were using the wrong form of hormone. They were using, just muscle building stuff. Or they took the testosterone level into the 2,000, 3,000 range. That's not physiologic. That's called super physiologic. That's when you're going to get into.
That sounds attractive, though.
But it is attractive if you're a bodybuilder.
Right.
But you know what, Brad? The problem with that is that down the road, there are problems.
Yeah. What are those problems? Curious.
What Trey just said. Those super physiological, and I tell this to my patients, if you're coming to see me and you expect to get into those ranges, which are what I call dangerous, it's not going to happen. The other thing that I see, and I see this driving down I-75, I see it driving down 95 when I'm in the Miami area, testosterone clinics, testosterone injections, those are deadly. There's no blood work, there's no follow-up, there's no knowing how to manage the complications of these therapies.
Yeah.
Because it isn't just giving somebody a therapy, it's what if?
Right.
What if there's this complication? What if there's this complication? What if you start to lose your hair? What if you lose your libido? What if you're a woman and you start to gain weight and you're on the wrong dose? What if you're a woman and you start to grow hair? One of the scariest things is there's two things that will get a doctor in big trouble. Number one is if a woman gains weight with your therapy, or if she starts to grow hair. She will find you in the parking lot, and you will be
dangerous.
beaten. You
Chicks
will
with
get
beards
beaten.
are no good.
Yeah.
It's no good for anyone.
You will be beaten in
Maybe
the
by
parking
the
lot.
husband.
No. Not the husband, the woman. The
No,
woman
but the
will
husband, when
beat
his
you.
wife comes home with the beard,
That's right.
might be pretty angry.
You kind of open the door to what to watch out for scams. And one of the things, because, vanity is such a hot, it's an easy sell, right? So you see all these things when you're scrolling online. What do you want to look out for that are scams online that are going to play on someone's vanity as far as anti-aging, weight loss, and all that kind of stuff?
I think the biggest thing are supplements, because you can't sell testosterone and hormones online, right? I mean, clinics can sell that,
Right.
But you can't sell the product, if you will,
Right.
the testosterone online. If you're going to use a supplement, I'm talking about a vitamin supplement, right, online, there's a lot of things you have to look out for. Do you have high blood pressure? Do you have diabetes? Do you have heart disease? Do you have a sleep problem? Do you have sleep apnea? Because all of these things can interfere with the normal physiology, the normal functioning of your body. You can raise your blood pressure. You can raise your blood sugar. You can take your you won't raise your testosterone that much, but what you will do is you can convert your testosterone to something called DHT or dihydrotestosterone, and as a man start to lose your hair. You can also, if you don't do this right, you can take things that will aromatize, meaning you'll convert your testosterone to estrogen.
Yeah.
So there's a lot. You need to go, and there are a lot of people. There are a lot of people around who know what they're doing, but there's a heck of a lot of people who don't know what they're doing.
So how do we separate the pretenders from the real?
I think part of what you have to do is look at what training have you had? Who are you? What conferences have you been to? Are you a speaker? Are you somebody who can teach this stuff? Are you somebody who's comfortable with it? Let me give you an example, and I'm not going to mention any names. My good friend Jackie, who's here, and I were...
We love Jackie, by the way.
Yes.
And
House of Hilt.
And House of Hilt.
House of Hilt, best of the best. Best of the best.
Still use the eye cream.
Best of the best. I'm
Although
telling you.
I just got the Rocks eye cream, too. He gave some, eye cream. He's got some good stuff. But
No, but this is better.
Anyway, definitely better.
You're going to grow
Definitely
rocks on
better.
your face. Why do you want to do that? You want your face to get better.
I don't want my head to get that big.
We went to see a friend of mine. She's not a friend. He's an associate. He's somebody that I know. I don't do any work with him. And they were treating this person with testosterone. They were also treating the person with something called an aromatase inhibitor, which is an injection.
I remember, yeah.
And let me tell you, the dose was completely wrong. They were giving this person 1 milligram a day. The dose is 0.5 milligram every 2 weeks. The side effects that can happen with that are deadly. You're going to change
Worse
this
than
person.
just taking the testosterone without
Absolutely.
no aromatase inhibitor.
You're going to change this person into a woman. That's what you're doing because you're blocking so much testosterone. So you have to know what you're doing. You really do. I mean, would I just call some guy that I didn't know to come and fix my roof? No, I would get references. I would get referrals. I would look you up online. I would have a conversation with you. I would not do that.
You'd be surprised how many people actually do that with things like roofs and trees, and they just get unqualified people, and it turns into a problem.
And
well, that's the
turns
same
into-
thing with the doctors, though.
Yeah.
I mean,
and
Price
it's
doubles.
the same thing.
The price doubles. Right? You got to do it twice.
Because you're fixing the problem.
and I think the simple answer to the question too is you want to go with a licensed doctor, a real practice, not like an anti-aging clinic or just a hormone therapy clinic, right? Because those are pretty common, right? Where you can just
Right.
get your blood work done quarterly, if that, and they send you on your way, and
But
you're
they
not
don't
under
even
doctor
do the
care.
blood work.
Yeah.
A lot of times blood work isn't even checked.
Right.
That's my issue, is that they're not even checked. And by law,
You have to get it
the American
quarterly, right?
Urologic Society says if you're on testosterone, you need to have blood work done every 3 months
Yeah.
to check the levels, to check your liver, to check your estradiol level, testosterone, et cetera, et cetera. I mean, we can talk about this for days, and I teach a course in hormone replacement therapy and how to do it right for physicians, for doctors,
Right.
and to do it safely.
But just kind of broadly, you touched on it a lot, and we talk about this a good amount too. The misinformation on the internet, and we're just in an era where if enough people say something, all of a sudden it becomes a fact.
Yeah.
And between that and what you taught us about those old medical studies that are relied on, like the mouse study in the 20s, how does somebody who's a layperson like us even begin to know what sources are reliable? And are there markers in the professionals that we need to be looking for?
Well, the first thing is you need to be an MD, okay? That's number one. But there are MDs who don't know what they're doing. The second thing that I am very, very careful about, and I am starting to see this all over Florida, And it's more prevalent here than it is in any part of the country. And I have nothing against nurse practitioners. I have nothing against nurse practitioners.
I know where you're going, though.
But there's a nurse practitioner running the clinic and a doctor who never even sees the patients. She's using his license.
I bet he sees the P&Ls, though.
Right. That's the thing.
And then the big difference would be that nurse practitioner doesn't have the clinical experience that the doctor has.
Look, this is not for all nurse practitioners. This is not a blanket statement.
Right.
All right. You asked me a question and I answered your question. What I'm trying to separate here is there are a lot of nurses. I know a nurse practitioner in Texas who is phenomenal. This woman is absolutely phenomenal. I know another nurse practitioner here in Florida, in the Lauderdale area, who's absolutely phenomenal. The problem is, I think the biggest issue here, Felipe, that people need to ask is, how long have you been doing this? You know, how long have you been doing what you're doing? Is it a year? Is it a month? Is it 20 years? How long have you been doing this? You know, what's your track record? If you go to have surgery, I'm not going to go have surgery with somebody who has a big complication rate or has only been doing it for a month.
Yeah, but they don't really post those statistics online. So
you have to ask the
right.
question. You have to ask the question.
Seems like common sense.
It is. That's why we called our supplement line Common Sense.
Right. Hey, I don't know about you guys, but we're having a blast here getting to know Dr. DeSilva, learning about anti-aging. If you want to get to know him a little bit more, stay tuned for rapid fire questions fueled by food and beer.
Hello, I'm Dr. Derrick DeSilva. I'm an expert in anti-aging medicine, and this is Rapid Fire.
10 random questions, 10 specific answers, nothing off limits. This is Rapid Fire, fueled by food and beer. Everybody's got a nickname. What's yours?
My nickname is Dr. D.
What's your dad?
What's the one thing you can't live without?
What is the one thing I cannot live without? Tennis.
College football or NFL?
What's better, college football or the NFL? I would probably have to say college football.
The hyperbole is done. Now we can finally play the game. Look at that.
Whether it's Creed or Debbie Gibson, what's your favorite karaoke song?
Sweet Caroline.
Good times never seem so good.
If you could live the life of anyone for a week, who would it be?
The Dalai Lama.
Chilling on the beach or hiking in the mountains?
At the beach.
If you weren't in your current occupation, what other line of work would you be in?
I would be, if I wasn't a doctor right now, I'd be selling Mercedes-Benzes.
In a zombie apocalypse, what's your weapon of choice?
My weapon of choice would be a sword.
If you're chosen to be on a mission to Mars, would you go?
Absolutely.
If you were a professional wrestler, what would your entrance song be?
Never die young.
Never give up, never slow down, never grow old, never ever die young.
Well, I've had the privilege of meeting you before, and we had a great conversation about one of your patients locally. And I know you can't share too much, but I love the holistic approach you're taking and the way that you're doing. So why don't you share with the viewers and maybe anybody out there watching or watch this later how you approach your patients. I think you even call them something different, but your patients in a different manner than traditional medicine.
Well, what I do here in Sarasota is a little different than what I do in New Jersey. What I do here in Sarasota is really the model that I really like, which I'm moving towards. And what I do is, let's say that somebody, I'll use a typical scenario, right? Okay. It's a 52, 53, 55-year-old woman who is definitely, she's gone to her OBGYN, she's had her GYN checkup, and she says, look, I think my hormones are off, I'm menopausal, and the doctor says, those things are dangerous. Don't do hormones, they're dangerous. She's stuck. I'm going to give you something for sleep. I'm going to give you an Ambien for sleep. I'm going to give you an antidepressant because you're depressed, and that'll make you feel better. And, just take a multivitamin. They don't even say take a multivitamin, but those hormones are dangerous.
Right.
Person calls me. What I do is I do a full blood workup, right? And typically that blood workup will go through their insurance company. And it's the traditional stuff. But I will check your hormones. I will check your thyroid. I will do your vitamin D level. I'll do your vitamin B12 level. Because all of these play into what happens with your hormones in general. Yeah. I do get the blood work back. I do what is called a pre-interview. So a week or two before I see you as a patient, I will make a phone call. My office will set up a phone call. We'll do a 15-minute on, what you're coming in for, what are you going to do. That's when you get the blood prescription after that. Excuse me, I said that before. But I do the pre-interview, then I send you a prescription based on what you tell me. Is there something else I need to look at? From there, I'll set up an appointment to come and see you, or you'll come and see me. I will either come to your home. I like going to people's homes because I see the environment. One of the things that totally freaks them out is I say to them, I need access, and I won't tell them that before I get there because they'll clean it out, right? What are the two things I need access to?
The fridge and the pantry.
The refrigerator and the pantry.
I knew
Trey, you're on it, man.
Hey, I said the same
You're
thing.
fixing my roof. You're fixing my roof, man.
That's true. Wow.
But it's true.
Interesting.
The refrigerator and the pantry.
Yeah.
So, because I'll say to people, tell me what you eat and drink, and they'll lie to me. But if I'm in their
Buyers
home,
are liars.
What's that?
Buyers are liars.
Yeah.
So are patients.
I mean,
apparently.
and then I look in the refrigerator and there's 2 cans of soda, 5 cans of whatever, and I say, you can't do this.
Right.
You can't do this. And here's the commitment that I need from anybody that I see. I need a commitment from you that you are committing to your health. You don't have to commit to me. Because I'm just the lead, right? I'm just the guide. You got to do the walking. Mm-hmm. You have to commit to me that you are really interested in your health. And if you listen to me, you're going to feel better. That I can promise you. You do what I tell you to do, you're going to feel better.
I mean, that's obviously very different because the doctors aren't going to the houses. But what I think of when you say that is kind of like the frustration that a doctor that's practicing traditionally must experience because they don't have that opportunity, right? So I'm sure you feel like the results are in large part due to the fact that you're in their home and you're in their kind of life because that all plays a role. I don't know how much you can discuss, but the gardening situation and what that does in that case study. You remember what I'm talking about? Because that was really unique for me. It was why is this patient struggling with I think it was walking and some things like that, and then we realized that she grew up her whole life gardening, right, and there was some factors there. So
you're talking about that. What's very interesting, Brad, right now is on this day of this taping, this person is actually. The person you're talking about was a patient I saw in the Bahamas. Mm-hmm. And I've seen patients in literally all over the world. And I don't want to mention countries, but it's literally been all over the world. This particular patient was from the Bahamas. And they can't, and even now, they're still confused as to what's really going on with this lady because she has something called normal pressure hydrocephalus, meaning the ventricles in her brain is just swelling. And they can't figure out why this is happening. I traced it back to, I think, a toxin, and we're looking into this right now in the environment. She was in the garden. She was working in the garden for all of these years without shoes and using a fertilizer that was brought in from another country. Mm-hmm. I'm not going to mention the country, but these fertilizers are sometimes poison. As I said, I was born in Sri Lanka. In Sri Lanka, there was fertilizer that was coming from another country. Again, I don't want to mention the country. But
probably the same country as the other one, though.
The same country as the other one. It was poison. It was literally poisoning the rice fields in Sri Lanka. And they couldn't figure out why everybody that was working in the rice fields were going into renal failure, into kidney failure, and was needing dialysis. They traced it back to the U.S. Some epidemiologists from the U.S. came in, and they figured out that it traced it back to the fertilizer that they were using in the rice fields that were poisoning the people, and they were going into kidney failure.
Right.
So you have to look back. You can't just say, I don't know, or I think it's, you have to have an answer.
And cancer is a cell that, I don't know if is metabolized the right word, or like it grows essentially over, tens and 20s years, right?
Cancer, so here's
Starts
a great
as just a cell, correct?
Here's a great example of that. 9/11. The cancers of 9/11. There have been over, I think, 20, 30 cancers linked to, I think it's more, linked to 9/11. When is it manifesting? It didn't manifest 2 years later or 3 years later. You know when it's manifesting? Now.
Right.
23 years later. A cancer cell will take 20 years to grow and show and manifest. So this is why today we're trying to find blood tests, markers that will predict cancers in the early stages so that they won't manifest and metastasize 20 years later.
Can you expound on how the cancer is linked to 9/11?
What they think is the dust, the dirt, and remember those buildings had asbestos, those buildings were built, decades ago, and it was just all of the environmental toxins, the air, everything that was in the air, the toxins in the air, I think is what they're linking all of this thing back to. And it's not just one toxin. Right. It's the asbestos. It's all the other environmental things that were there. And there were guys that were just not wearing masks and. And I think the answer is yes. I think there's not one thing that you can do. I think it's a combination of things. I think it's diet. I think it's exercise. It's the usual thing, right? Diet, exercise, hydration, it's trying to stay away from the things that we know are poisonous. Example, cell phones. Cell phones. They're poison.
Yeah, how do we stay away from those?
Poison.
Wouldn't even be able to get you here if we didn't have one, though.
But that's the problem, right? Yeah. You will never see a cell phone on me. You'll never see those ear things in my ears. I think that's the stupidest thing that you can do.
You take a peek out there at the boiler room?
Yeah. No.
Those aren't. Those
are wires.
Some of
That's
them.
what I'm saying.
They're
Brad
wired.
is conscious about this stuff. That's why he puts the headphones on instead of the wires.
They're wires.
It's the wireless ones that are on Bluetooth.
The Bluetooth is where the problem
that are in
is.
your ear, too.
And here's the other thing. Where do men put their cell phones?
In their pocket.
There's two places. You're putting it between your legs.
Felipe had his phone between his legs.
So for the last 30 minutes, you've been radiating your you-know-whats. Okay? But that's what happens.
Interesting.
But that's what happens. You're radiating your
EMF,
I don't want to say the words, but you're radiating it. Mm-hmm. Where's the other place that men put their cell phones?
In their top pocket,
Because we got a pocket here. Mm-hmm. What's here?
Your heart.
Your heart. Where do women go? Walk through a mall, walk through your office here. Where do women have their cell phones?
Their purse.
In their hand.
Their purse.
Their back pocket.
Okay.
Their jeans. Women wear jeans, and it's in their back pocket. What are they radiating? They're radiating their entire pelvis, their ovaries, their uterus, their rectum, their intestines. That entire area is being radiated. If it was once a month, it'd be fine. But it's every day for 8 hours.
Yeah.
That's the problem. So you're asking me about cancer? Why are 30 and 40-year-old women today having more breast cancer than we've ever seen? Why? When I started practice 38 years ago, 40-year-old women didn't have breast cancer. 60, 70, 80-year-old women had breast cancer. Today, they're 20 and 30 years old. I have a 30-year-old woman in my practice with breast cancer. Yeah. You're like, what's going on?
I thought the rates for that were going down.
No.
They're not. They're going up, and you're seeing younger cases.
They're going down in the 60-year-olds, and they're going up in the 30-year-olds.
Yeah, because they had it in their 30s, and now they're good in their 60s.
It's incredible. It's incredible what's happening out there. And if we don't get our act together soon, it's going to be a problem.
So what would you say, and we know there's a plethora of them, right? But what would you say the biggest single thing plaguing Americans in health is currently? Not just misinformation, but like for me, I would feel like if I took a stab at it, would be diets, right? Like the food we eat. And that's really just because I think, the last time when we had Jackie on the podcast, you and I had a discussion kind of after, and the learning curve for me to like realize, like my wife really jumping into this stuff and ingredients and like apps like Yucca where you scan the thing and it tells you what's in it, and it's eye opening. And so that's only been for me maybe the last 4 years, 5 years since I've had kids that I've really looked into this, and I'm like, whoa, there's so much bad information. But would you agree that it's diet, or what would you think is like the main cause?
I think diet is a biggie. Give you an example. You would have to eat 12 bowls of spinach today to equal the iron concentration of one bowl of spinach from the 1930s.
Whoa.
Okay?
Who's watering down the spinach?
The spinach,
Popeyes
the
is not
seeds,
the same.
The way it's grown, when it's picked, the soil, there's so many factors. So that's one thing. The next thing is, I'm going to tell you my theory on disease. When I was training, I finished my residency in 1988. So I did my residency from it was longer than that, but for 4 years, right in the late 80s. When I was in my residency and in my training at the time, atrial fibrillation, right? If I said atrial fibrillation to a 30-year-old, 40 years ago, you'd look at me and say, "What? What are you talking about?" Today, I'll bet you every one of you knows what atrial fibrillation is. You know why? Because you're hearing it on the commercials, and you even know the drugs that'll treat the atrial fibrillation today. The drugs that thin the blood
is one like
yes you can't say. You know what they are.
We can edit it out.
We can, you can. You know that those.
Was I right though? See,
you were right.
I was just testing if I didn't know.
But the question is, why are there so many people with atrial fibrillation today? The guy sitting on the plane next to me with the wife was in the middle seat. He was in the aisle seat. She said, "Oh, he has atrial fibrillation." Why? He was 70 years old. Okay, I get it. Why are 30 and 40-year-olds getting atrial fibrillation? You know why? There's no minerals. You need calcium, you need magnesium, you need certain minerals to protect the heart.
Yeah.
You're taking acids to block the acid in the stomach. If you block the acid in the stomach, you are not going to absorb minerals. You can't absorb minerals. You can't absorb calcium, you can't absorb magnesium. You can't absorb iodine. Iodine is taken out of the food supply. I will bet you, now you may know, I don't know about you two gentlemen.
Maybe.
What's your vitamin D level?
Oh, I don't know.
I do supplement that because I did read a paper on how people with darker skin need more vitamin D.
Yes,
and
true.
It's often misunderstood.
True. But do you know your level?
Do you know your level? So the question was, do you know your level?
No, but he's right.
I can
he's
pull
right.
it up. I don't know off the top of my head. I can pull it up.
But here's the deal. Here's the deal. If you're a woman and your vitamin D level is less than 50. Now remember, the reference range for vitamin D is between 30 and 100.
Another huge range.
Another huge range. If your vitamin D level is less than 50, European Journal of Cancer 2005 is the reference. You have a six-fold greater risk of developing breast cancer. We're in Breast Cancer Awareness Month, right? I don't want to date the show. But I'll bet you none of the women out there listening to this know that. You want to prevent some of these diseases? Do some basic nutrients. Vitamin D, vitamin B12. Take a good probiotic. If I had to pick 3 things, it would be a good probiotic, a good vitamin D, and maybe a CoQ10 depending on your age.
So it's in other words, it's kind of your answer to the question is basically like a lack of vitamins.
Lack of nutrients.
Yeah.
Lack of nutrients.
So it's diet, but more specifically, lack of nutrients.
Well, the nutrient lack comes from the lack of the nutrients in your food,
right,
in the diet.
Does eating organic make a difference? In our country, based on the organic standard, I mean?
Possibly. You're paying more for it,
yeah,
and you think you're getting more for it, but are you really? Are you really getting a better tile for your roof? Or are they using the same junk that they used before?
Not if it's strong.
Well, not if it's a good tile.
But I'm glad you broke it down for us, because what I think we hear a lot of on the internet and other places is people always want to have a silver bullet.
There is no silver
one
bullet.
or two things, and that's BS.
I wish so much that there was that silver bullet. I really do, because I would give it to everybody. My dear friend Jackie has always said to me, and on the way over here, she said, "So, what's your message? What's your mission?" My mission has always been to heal the world. That's my mission, is to heal the world. And if I have to do one of these every day for 20 years, I will do it.
I think you have to do more than one, but
yeah,
probably 10 a day for
But seriously,
20 years.
That's my mission.
Now that you're on the mission, do you want to expound upon something you spoke about off air, your health span versus your lifespan?
Yeah, and let me just say to that point, because that's exactly what I was thinking, like with the health span versus lifespan, right, which is your thing. I feel like when we talk about these things, right, because I'm probably middle of the road. Like, I'm not drinking sweet teas every day like I used to, and I'm not, drinking only vitamins and mineral water and, whatever. So, and I'm not just eating clean all the time. Right. There's some junk in there. But when you really factor in like the why behind it and like the motivating factor, somebody's why, I think it's mainly a misconception on this topic. So I'm excited for you to talk about it, because if you meet somebody, and I have, but if you meet somebody that's 80, 90, 100 years old, 90, I got an agent out there who's 71. He was playing desk chair soccer we had Office Olympics, right? Yeah. He's scooting around the office in his desk chair playing desk chair soccer. He's living great at 71. He's very healthy, happy. But you meet somebody that's 80, 90 years old, not on any medications, out there on the golf course, bombing the fairways past me. I'm like, okay, so you can live to 85, 90, 100 years old doing most of the same stuff you were doing. Right. That is a motivating factor for me. Just living to 90 isn't, because traditionally you think...
That's health span.
Correct, right. So I'll let you
versus
take it
lifespan. There. So, by the way, I'm not too far from that 71-year-old dude out there. Okay, so just,
well, we'll sign you up for the next desk chair soccer.
You sign me up for the next. I'll take anybody on in pickleball. So just let me know when you're ready. But
love it.
The idea of that, and again, I'm going to use my dear friend Jackie. She's sitting here. Her father-in-law, he's 95. This guy's 95, and just coming from the house, I was doing some work this morning. He just got back from his personal trainer. I said, how are you doing? He said, Doc, I'm feeling great.
That's incredible.
And he was on his way out. Actually, he saw the chiropractor, and he came in, he kind of hung out with me for a little bit, and was on his way to the chiropractor. And from the chiropractor, he was going to a Thai massage. I'm like, dude, man, you're living it. You're killing it. But that's what he does.
Right.
He's active, he's exercised, and he's an engineer. So his analytical mind, I mean, he does refresher courses every year for certification.
At 95.
At 95. And it's like, he's unbelievable. He still flies his plane with
Wow.
another pilot.
Right.
But, I mean, that's what you need. That's the lifestyle that I want.
Yeah.
If I'm
me
not gonna,
too. That sounds great.
Exactly.
The time massage. The time you got to get a time massage.
I knew someone was going to
hang out
go
with this
there. You can always scale it down to like. I'm telling you,
I think I'm good with that.
I'm telling you, it's not him. But I knew there was like that's. I'm glad you brought that up because there's also somebody watching this that's thinking the same thing. Like, yeah, of course he buys his health with his money. He's got a plane. He's got a Thai masseuse. He's doing all this stuff. There, you can do this at the cellular level with food. And it doesn't have to be organic food, right? I mean, organic would be better, but it could be, affordable to maintain that health span. So as soon as you said that, I knew like someone was out there thinking.
I'll give you the prime example, Brad. My grandmother is older than he is and takes zero medication.
Right.
And still plays bridge 3 times a week. And
older than he is. You talking about me?
No, older than the gentleman.
I said you said.
What'd you say?
Dude, wait a second here.
I'm not gonna.
You're older than
I'm not gonna betray a lady's age. But she's older than the 95-year-old gentleman
that's
that you
awesome.
referenced.
And just still doing her thing. No medication.
Cooks her own dinner every night. No maids. No cleaning people. No nothing like
That's
that.
incredible. So.
Wow.
And that's that. I think
a lot of it is the food and the lifestyle choices.
100%. And when you start to think about it as you're aging, or even in your younger years, you meet somebody that's 95, and whether it's your grandmother that's however old, we won't say, but making her own meals, going to bridge, taking no medications, or it's somebody flying his own plane. It's like whatever your lifestyle is, you can maintain that lifestyle late into your your later years. Just by taking care of yourself.
The other thing you can do, take your shoes off and go to the beach.
Grounding.
One of the things that I have to tell you that the folks, for those of you that are listening,
if you're like me and you hate the beach, it doesn't have to be the beach. It could be the grass.
It could be anywhere. You don't like the beach?
I just don't like the sand. Not a big sand guy.
Oh my God, I love it.
I don't hate the beach. I would rather be on a boat.
That's fine, and that's fine. But
or if I'm grounding in the grass.
Take your shoes off, and it doesn't need to be at this big major project. All right, grounding, earthing is a huge deal. And by the way, do you know one of the best places on the planet to ground at the beach, by the beach is?
Siesta Key.
Sarasota, Siesta Key, this whole area.
Florida,
you're talking about the vortices?
Yes.
Yeah.
This area is one of the best places on the planet to do that.
Wow.
So, folks,
based on.
Okay, can you break down a little bit of that for people that have not heard of this
don't
before?
know what grounding is?
And the vortices,
No,
and why Sarasota.
just this specific reason, because we're on Sarasota SpeaX.
The other one, Sedona, is
Right,
another one.
Sedona's another one.
There's a bunch in the United States.
It has to do with energy flows, and people hear stuff like this and say, all right, there was a full moon last night. Like, what are you talking about, dude? It has nothing to do with that. We are all energy. We would not be able to do an MRI on ourselves if we didn't if we weren't energy, because we are energy. And that's what an MRI is. It stops the electrons and it takes a picture.
Yeah.
Essentially what it does. So if you don't believe your energy, fine, that's your problem.
You're
all right?
screwed.
But you're in big
Can't help
trouble.
you.
But it has to do with energy flows and the way the energy is in certain specific areas. Why is Sarasota that? I can't give you the physics of it. What I can tell you is that there's a very strong energy field in this area. There's a very strong energy field in Sedona. Again, I don't know the physics, but I do know that
there's
those areas.
some geologist or
There's
whatever
something that
knows
right.
something about it. It's just not your area of
And I'm
expertise.
sure they've
right?
got some way to measure it.
Oh,
like
yeah,
you said,
they're
like
absolutely.
the MRI, right? They know.
Exactly.
We don't know why, but there's
they know that
there's
it
a lot of
works.
energy here.
Absolutely.
So take your shoes off and go walk on the beach, right?
I feel like I'm beating this one up, but again, this is another episode where you love being the guys in our seats learning this stuff, because I could sit here and talk about this for hours.
Mm-hmm.
It really is like something that, for a while my wife I'm like, come on, I'm going to still eat these Oreos, like, or whatever it was at the time. But it's slowly like, okay, as I lose my hair, or as I feel a little more pain in my knee or something, I'm like, you know what? Maybe I will eat that organic stuff she's buying or whatever. Right. So, right. But while we're on the topic of Sarasota, I wanted to kind of shift over to some Sarasota-based questions, if that's okay with you.
Sure.
All right. So I'll leave it to my man, Trey.
Eric, cue the roundabout. Terminator Law and Trey Martell want to know.
What's that?
What are your feelings on roundabouts? Do you love them or do you hate them?
What are you guys in New Jersey? What's the deal? New Jersey is all about roundabouts. All of a sudden, we're seeing them here in Sarasota. I know how to drive around a roundabout because I've been driving in New Jersey, but
we're still learning.
Why are you doing them here?
We're still learning. But I think the general consensus is we're doing them here because they don't break like traffic lights when the power goes out, right? They don't require an officer to stand at them in the middle of a hurricane when there's no traffic light. And if you do get in an accident, it's much less deadly, right? You're going slower.
You're going 2 miles an hour.
I'm just speaking for the city and the county that's putting them in. I don't know if that's really why, but
I think they're state funded.
I think we got some free money on that one. There you go. Because they just built 4 in a row on 41.
Put some roundabouts in, we'll give you some money.
Yeah. Well, use it or lose it, right?
Yeah.
So
it's bureaucracy.
And my fiance, this is her question. What are your thoughts on Ozempic? Is it as bad as people say, or is it?
Oh boy.
Can I say Hail Mary before I answer this question? Is it okay to say Hail Mary on the air? Not a problem, right?
No problem.
As with most drugs, using anything short term to jumpstart you is probably a good idea. Using it long term, when you start to sacrifice muscle versus fat, slowing down your digestive system and mimicking diabetes, is probably not a good idea. So, as part of this, if you need to use this, fine. If you're 350 pounds and you need to lose 150, 200 pounds, great way to do it. But change your diet, change your lifestyle. Don't become a slave to an injection.
Is that your general feeling towards most prescription medications? Like how are you? Because obviously I wouldn't say you're Eastern medicine or Western medicine. You're kind of a combination of the both. So do you treat with drugs or?
I do. It's called the best of both worlds.
Okay.
Right. There has to be. If you come in to see me and your blood pressure is 210 over 120 and you're having a nosebleed and you have a headache, I'm going to probably give you a prescription medicine and send you to the emergency room. But once you get there, I'm going to get your pressure down and I am going to kick your butt and I'm going to make you lose weight and I am going to make sure that you do what I tell you and get you off that drug.
And then eventually, hopefully, you get off that drug.
Yes. Another example, acid blockers. The acid blockers really became prevalent in the early 1980s, late 70s, early 80s. I was in medical school at the time. And what we found was that they were initially, you know what I'm talking about, right?
Nexium.
The acid, the acid blockers.
Reflux.
Right.
Yeah.
They were, when they first came out, they were supposed to be used for 10 days to 2 weeks. There was a study done that says, we can extend it to 6 weeks. It was a mouse study that said we can extend it to 6 weeks. Love the mice. To 6 weeks. To 6 weeks. It then went to, we can extend it to 3 to 6 months. Now, it's the rest of your life.
Now, what's driving that? Obviously, to a layperson, the companies that
the lay people know this now.
Yeah.
This is, you don't have to be anybody special to understand this.
Yeah, the motivation to extend that lifespan of the drug or taking the drug is driven by the pharmaceutical companies, correct?
You know what, Trey? I think if you look at what is happening, I think the public is getting very smart. I really do. I really think they're getting smart.
After that one jab that everyone had to take.
I think they're getting smart and they're starting to pay attention. And all I'm saying to you is pay attention. You know, what's driving it? I think there's various reasons that it's being driven the way it's being driven. But I think we have to step back and say, what's best for me? You know, do I need this? Can I use something with this? For example, I'll give you an example of this. If you're using an acid blocker, take a probiotic. Take a probiotic because what's happening is your food is being fermented instead of being digested, right? So let me help this along by giving you the good bacteria. Take a probiotic, right? Over a period of time, work with your doctor to taper off that acid blocker and Do what you're supposed to do and eat the right food. Don't eat the sugar. Don't eat the garbage. Don't eat the junk. If there's one thing that'll kill you, that's inflammation from sugar. That is the bane of our existence that's killing and producing all disease today, without any exception.
I'm just so thankful I don't have a sweet tooth, like much of a sweet tooth. Even if I eat, it's not much. So, well, Felipe, with that, I would like to pass it to you, brother, for our famous last question.
We could go on way too long. We'll probably have to have you back
for sure. I'd love to.
And hear more about what you're doing.
I like your copper bracelet.
Thank you. Appreciate that. We'll talk offline.
Yeah.
Got a guy. We always ask everyone, you've been on Sarasota Speaks. You see what we do here. I think you see why we do it. Mm-hmm. Who do you know who we may not know who Sarasota needs to know?
Here in Sarasota?
Connected to or in Sarasota, or can at least get to a taping.
Or can make it here.
Well, there's a gentleman here who I have a tremendous amount of respect for. He was the president of the International Androgen Society. His name is Dr. Abraham Morgenthaler.
Are we talking androgen, like androgen?
Testosterone.
Okay.
Testosterone. He is the world's expert on testosterone, and he lives here in Sarasota.
What?
Yes.
Morgenthaler?
Dr. Abraham Morgenthaler. He was the director he was the head of the Department of Urology at Harvard.
Wow.
He's Harvard University, and Abe is the best. He is internationally renowned.
You're gonna have to help us land that one. That's an awesome.
Jackie knows him.
We can continue this conversation about hormones with him as well.
Jackie knows him, and he is phenomenal.
Well, Dr. DeSilva, like we said, we could literally talk about this for hours, but we got to land the plane at some point. But we really appreciate you coming on, and we would love to have you back at some point to go deeper. Thank you for everything, for sure.
Thank you.
Thank you so much.
Thank you so much.
Keep that phone on.
Look at the timer right now.